Hello everyone, welcome to the Stylist Squad. We are here with one of our most unique episodes with the Stylist Squad where we are going to talk about one of the global issues right now, the coronavirus. Now this is our bit from this channel that we want to address to our viewers and share what are the things that we could do to prevent this virus further and also to take some necessary steps. Now to talk to us more about it, we have one of the geniuses in the field of medical science. We have Dr. Intezar Mehdi with us. So Doctor, welcome to the Stylist Squad. Tell us a little bit about what are your views about the current issue that we are dealing with.
Thanks Naushad, and thanks to the Stylist Squad for having me here. I think at present coronavirus problem is a global health problem, and I thought it was prudent for us to put this message across our channel just to help people understand more about this problem and to learn more about this problem, how to prevent it further, and do not get too much worried about this problem. Yes, it's a big problem, but we have to understand the do's and don'ts of this problem.
Absolutely, yeah. Now, we've been hearing a lot about this. We also know that this is not one of the first viruses. We know that there are a lot of other viruses as well. Why is this so important and suddenly taking the world and it's causing trouble so much to the people? How is this virus so different, Doctor?
Now, coronavirus was detected earlier in about 1980s, but it was mainly in the animals. And in about 2002, there was a problem called as SARS, which was a respiratory problem, respiratory failure. A lot of people were affected globally, and there were deaths reported as well. And then in 2012, there was also something called as MERS, Middle East Respiratory Syndrome, which was first described in some of the countries in Middle East. That also caused respiratory problems and caused significant amount of death. So it's not new. In 2019 December in Wuhan, that's a city in China, they first reported this type of problem where patients who normally presented with flu-like symptoms deteriorated, had pneumonia, and then went into respiratory failure, and some of them eventually died. And at that point of time, they detected that this virus also belongs to the same family of coronavirus, and then they named it as novel coronavirus, and now we call it as COVID-19. So it's not something new, but then it has come from animals to us. Whether it has come because of close contact with animals or because of eating those animals is all for discussion. But more importantly, now that it has come in humans, the problem is it is getting transmitted from humans to humans. Mainly because the illness that it's causing in humans is a respiratory problem. That means it's causing cold, cough like symptoms wherein it can get transmitted to others. So that's the problem currently we are facing now.
Yeah, but what do you think the problem could be? Because if the spread is vast, right? The globe is affected, all countries, irrespective of the developed nations or not, they're all affected. What do you think the biggest problem could be that this is spreading across different countries as well, different regions?
Now, if you compare to other flu viruses or other influenza-like viruses, which normally cause cold and cough, the death rate in this virus, as per the global statistics, WHO has told that the death rate is about 1 to 4%. That's not very high if you look at it. For example, the previous SARS, as I just mentioned, had a death rate close to 10%. MERS had a death rate close to 30 to 34%, which is much higher. Why are we getting so much worried about this virus when the death rate is only 2 to 4%? Now, currently, let us just spend a minute here on what's the global problem look like now currently. Now, as on 15th March 2020, that is today, we have close to about 1,50,000 cases worldwide reported, and there has been close to about 5,000 deaths which are reported. And currently, the biggest three affected countries are China, Italy, followed by Iran. And then it has spread to various other European countries, in the United States, and then in our country in India. As of today, the Ministry of Health website says that we have crossed the 100 mark. We are close to about 107. Yesterday we were about 80 odd, today we are 107, and there has been 2 deaths reported out of 107 cases in our country. So that big is the global problem. Now the death rate in China is close to about 2 to 3%. Whereas in Italy and Iran it's close to about 6%, 6 to 8%, so it's a touch higher. So the other thing is the contagiousness of this virus is much higher than the other viruses, flu viruses. That's the problem here. That's why it's spreading like fire actually. So unless we will discuss more on that, how we are going to quarantine or how we are going to prevent the spread. More importantly, the second infection rate is about as high as 60 to 80%. If you talk about WHO or the infectious disease experts, they say that if we don't take precautions, then the cross infection rate is in the tune of 60 to 80%. So potentially it has a capacity to actually infect large groups of population, because before you realize that we have a problem, it has already it has infected many people, and that's why the cases are being reported like this. So that's why now the WHO has declared it as a global pandemic. That means it's a problem which has spread across the world, affecting many countries. So it's a global health problem. So all the countries put together, WHO, all of us are trying to work on it to contain the virus, how to limit the spread, and the cases which are affected, how to treat and come over it. So I think this is a public health emergency across all countries, and everybody is coordinating with each other to see how we can actually prevent the spread and how we can control this particular pandemic now.
Yeah, I think one of the most interesting points that you also mentioned is you can only prevent this virus once you're aware of how do you prevent this. So what are a few things that anybody should keep in mind when you're talking about prevention of this virus at its face value? So what are a few things that you would recommend, doctor?
Yeah, I'll come to that, Naushad. What I thought is more importantly, since the death rate I just told you it's about 2 to 4%, but there are some vulnerable groups which are more at risk with these viruses. Let's just touch on that, and then I'll come to your question there. See, what happens is, like most of us, when we are having cold cough like symptoms, it may be normal flu, it may be the normal influenza virus all of us get, and then we get better. And the recommendation from WHO is also that if you are having a normal cold and cough, you just stay home, isolate yourself so that you don't cross infect others, because we don't know whether you are having coronavirus or it may be a normal virus. But more importantly, even if you are having a coronavirus, what you have to do is you have to self isolate yourself so that you don't prevent the spread. You have to prevent the spread to others. The recommendation is only if you get a serious kind of illness. That means if you get pneumonia like picture, you have chest pain, breathlessness, you are requiring admission to the ICU, you are requiring ventilator care, that is when actually you have to be screened whether you are having coronavirus, because you may need specific treatment. Now there are some vulnerable groups which are more prone to the serious problems occurring with coronavirus. These are like, some of them are like, old age people, especially people who are more than 50, 60, and people who are having diabetes or hypertension, people who are having heart problems, people who are having respiratory illness like for example asthma, those patients who have had kidney transplant so that they are on immunosuppressants, that means their immunity levels are lower, or patients who are receiving chemotherapy, for example for cancer, their immunity levels will be lower. So in immunosuppressed, that means those who are having decreased immunity, in those people the illness will be more severe. Importantly in children also, until a couple of days back it was thought that the number of cases being reported in children is lesser, and they thought that probably children are quite immune to this, but that's not true. Yesterday WHO has told that children are also getting equally affected. Probably their immunity levels are better, especially in children in the age group of 5 to 15. Younger infants, for example children below 2 years, or those neonates less than 1 or 2 months, their immunity levels will be very low actually, and they are also one of the vulnerable groups. So these vulnerable groups, if they get this virus, then their chance of having complications like pneumonia, ICU admission, requirement of ventilator would be really high. Once they go to respiratory failure, then what happens is majority of the time they go to, God forbid, multi-organ dysfunction, and that is when mortality or death happens. That's what is happening globally. And then to touch upon your question,
what do you do to, first basic steps of being aware, how do you prevent this?
Yeah, I think this is the most important message that we want to give to our viewers. I think the main purpose of having this message on our channel now is to create more awareness on this. So there are some basic steps what we have to do about it. See, strict hand washing for 20 seconds, that's the rule. Okay, so every time you enter the house from outside, okay, you do hand washing with soap for 20 seconds. So there is a saying that you can actually say the happy birthday song twice, so that 20 seconds are there, but you can do anything you wish. So hand washing has to be proper. It has to be like this, it has to be like this, it has to be like this, then it has to be like this, then it has to be so, then interdigital. So for 20 seconds strict hand washing with soap and water, that's the norm. Wash as many times as you can. Which soap is not important, any soap with running water is important. Wash as many times as possible. Every time you have touched an object, you have gone to the market, you have done some shopping, you have brought fruits, you have brought vegetables, you have done some household work, you have done some kitchen work, before and after the loo, every time keep washing again and again. Then if you are not able to do soap water hand washing frequently, the other option is, second best option is, use hand sanitizers. Most of the sanitizers are alcohol based, 60 to 90% alcohol, commercially available. You can use them and you can scrub your hand every now and then. The third important thing is to have something called as cough etiquette. That means if you are having any kind of running nose or cough like a normal flu, please maintain distance from your near ones. So when you are coughing, use either a tissue or a handkerchief to cover yourself. If you don't have anything, then you can just use your elbow so that you don't transmit it to the others. And at this point of time, because of the coronavirus outbreak, if you are having a flu, kindly stay indoors in your house and limit your gathering even with your family members, so that to avoid the spread. So these are 3-4 things. Also avoid cold foods, ice cream. At this point of time, drinking boiled water or having salt water gargle with warm water would be very beneficial at this point of time. Limit the use of air conditions. These are some of the basic health tips that we can do at this point of time to prevent the spread. More importantly, now what's happening, what has WHO done? They have done what is called as quarantine. What is the meaning of quarantine? Now what most of the international authorities, what they recommend is, because the virus has very fast cross infected from one country to another because of people traveling all over the place for various reasons. People travel for business and many other things, so leisure and stuff like that. So what has happened now, for example, government of India about a few days back, they put a ban on travel across, people coming from outside to here and people going from here to there. Similarly, most of the countries, Italy, China and most of the other countries have stopped air travel, stopped all kinds of travel and told people to stay where they are. Please don't move from places. So this is one of the most important strategies. So for example, at this point of time, government of Karnataka yesterday imposed many of the preventive measures, like they shut schools, colleges, except exams, offices, work from home, shopping malls, movie theaters, all. So mass gathering at this point of time should be avoided. So whichever is avoidable mass gathering, any kind of events, sports events, cultural events, stuff like that should be just avoided. And for example, some unavoidable kind of stuff, like for example, somebody's wedding is planned in the family and it cannot be rescheduled because too short of notice. Limit the number of people. You are supposed to get 1,000 people. Please try to see if only 100 people can participate, or 50, even better. Let it be a more kind of homebound affair. And even in that wedding, the message should be like, if any member of the family, however important, however close relative of the bride or groom they may be, but if they are suffering from cold and cough, please do not come to that wedding, so that keep yourself safe and prevent the spread to others. So these are some of the things. So for example, some unavoidable circumstances, somebody has died in the family, God forbid, for somebody, funeral has to happen, most people would go there. It's okay, try to limit the amount of time that you are spending with each other. And then most importantly, when we meet with each other, we greet each other. Handshake is so common. So now the mantra is, please do not do handshake, do a namaste or do a hello kind of thing, because handshakes would spread the virus very fast. Also, this virus survives outside the human body for some time on surfaces. For example, God forbid, if I am carrying the virus on my hands at this point of time, and if I touch this beam here and then next Naushad touches there, it may just come onto his hand. But from his hand, it will not go into his body directly. It needs a carrier transport. So for example, if Naushad, after touching this place, then touches his face, so one of his mucous membranes, either from the nose, mouth or eye, it may just enter. So one more thing is, whenever you are here and there, you are touching surfaces, please do not touch your face. Okay, every time that's
avoid
touching your face. So even if you have touched some stuff here and there, you have gone out and come, unavoidable symptoms, you had to go to the market, you had to fetch something, or your kid is having exams and you had to drop them and come back, please do not touch your face and wash your hands as frequently as possible. So these are some of the important things, I think.
I mean, when we were talking about touching face, I've seen a lot of people right now, I think it's the biggest seller, people prefer wearing face masks. I mean, what's the trend behind that? Does that help avoid, or when do you actually wear a mask when it is not recommended?
I think WHO, World Health Organization, and most of the infectious disease experts, and yesterday I saw a video by one of the directors of AIIMS, All India Institute of Medical Sciences, one of the biggest institution in our country. That director, he was also asked a similar kind of question, and see, at this point of time, wearing mask is not going to prevent the spread of this virus for sure. It's not going to spread. Okay, it's not going to prevent the spread. People who are having cold and cough should wear mask to limit the transmission spread, but they should stay indoors. They should not be roaming around. See, unavoidable circumstances, if they have to get out of their houses, then they can probably wear mask, and so the mask will prevent the spread of virus from the person who is probably infected with either corona or similar kind of flu virus. So for normal public, wearing mask is not going to prevent this. What precautions I told a few minutes back, hand washing, avoid handshakes and all those precautions, those are most important. Sometimes you get a false perception that just because you have worn a mask you are completely protected, and then you stop doing this hand sanitizer, hand wash, and you touch surfaces here and there, and then you just put it on the face, and while actually removing the mask and putting back the mask, there is a risk that you might have touched surfaces and the viruses may actually get transferred, and you might use the same mask for few days, which would become unhygienic, and then it may spread not only coronavirus, other infections also, because nowadays mask has become a luxury. It's not so easy to get in the market.
That's true, yeah.
Because it has created a situation like everybody is worried, and if you see people, everybody is going around with the mask, so you are reusing it, so that's a problem. So if you are having cold cough, the most important thing is you need to stay home. You should not, and in the home you try to corner yourself in a room, limit your travel, do not get out of your room actually, but if you have to get out of your house, make sure that you are wearing a mask so that you protect the others from spreading. But otherwise, general public using mask is not going to help.
It's not going to help. Madam, you did speak about frequently, as frequent as possible, we need to wash our hands. But how about sanitizers? Because they do have some alcohol. You did mention 60 to 80%. It helps clean your hands. But how often is that recommended? Is that also as often as you can, or and how frequently should I do it?
Now see, Naushad, for healthcare workers like us, we always follow these precautions like hand washing frequently as much as possible, and in between the patients we always use hand sanitizers. Like we have seen one patient, then we are seeing the next patient, we have touched any object, we have touched the book, we have touched mobile, whatever. So probably in a day I might be using the hand sanitizers close to 50 to 100 times, but that's for healthcare workers. For common man, at this point of time, have the hand sanitizer handy in your homes, and every now and then when possible, you just keep doing it. So there cannot be a number. It's like, for example, you started doing your work in the kitchen for our kitchen cooking, for example. So before starting that work, he or she would have definitely cleaned their hands properly, and then they are doing. Suddenly you get a phone call in between, and you answered the phone and you have to go back. Ideally, go back and wash your hands with soap and water. If not, at least use the hand sanitizer before you continue work. So something like that. So it has to be
extremely sensitive.
Extremely sensitive. Yeah,
be careful.
Yeah, we have got to be careful. Yeah.
Fair enough. So doctor, just a while ago you did speak about this virus being transmitted. Can you talk to us a little bit more about the transmission of these viruses?
Yeah, so coronavirus basically spreads through droplet infection or contact. Now what is the meaning of droplet infection? Somebody who is infected with the virus, the usual symptom will be cold and cough, and importantly, coronavirus does not cause wet cough. That means there is no phlegm. Usually it's a dry cough. So let's not be too much relaxed about it. No, I am not having a wet cough, there is no phlegm, so I am not having coronavirus. No, dry cough, sore throat, bad sore throat, high grade fever, that's the usual symptom. So if somebody is coughing and sneezing, then the droplets which come out when we cough or sneeze, actually the virus comes out, and whoever is in close proximity, especially within 2 meters distance, they can just inhale that virus and spread. So virus is not airborne at present. So virus is not just there in the air all the time. If it was airborne, by now it would have infected the massive population, billions of people, and it would have been very difficult to contain. Thankfully, God has been kind enough. So it's droplet, and then contact, as I mentioned, it just comes in your hand, and then you shake hand with somebody, or you put it across on some surface, and then we touch it. So that's how it is spreading presently.
All right, I think that's really helpful to know. I think that's why it's important for us to cover our face whenever we are coughing and sneezing, and of course stay isolated. But doctor, we've been hearing about the global shutdown. I mean, we haven't heard over years now that airports have been closed, harbors have been closed. People have been asked to avoid travel, refrain from traveling. Why is it important for us to respect that decision that the government has taken, and what's the role that we could play there?
See, the mode of spread of this virus is, as I just mentioned, it's from close contact, and then the virus is spreading so fast. Yes, some of our own colleagues and some of our friends have talked that in the last 2 months there have been more deaths probably because of accidents, infectious diseases, tuberculosis, cancer, or some other preventable disease rather than from coronavirus. But why we are talking so much about coronavirus? We have about 5,000 odd deaths in last 2 months, which is a big number, but at the same point of time worldwide there have been probably more deaths with other diseases rather than this. Other diseases, due respect to all cancer, tuberculosis, infection and stuff like that, we know about these diseases, we have some treatment options, we have preventive strategies, we have implemented this. In spite of that, worldwide this many people will get affected and will die. This is a new problem which we are facing, and potentially it's much more dangerous than what we are seeing now, because globally global shutdown has happened, quarantine has happened, countries have stopped travel, most countries have banned gatherings and so many other things which we spoke on this channel. That's why the numbers are right now 1.5 lakhs. Otherwise probably it would have been 15 lakhs, God forbid 1.5 crores or higher. And as the number of cases would increase, the chance of deaths would also increase. So that's why it is so alarming. So with due respect, World Health Organization, international health organizations, most countries, and whatever steps they have taken at this point of time is very apt. And in fact there are a couple of countries which were not aware that the problem would be so big, and once this happened they realized and they said, oh, we should have done this a little earlier. So that's how it is happening. So I think our country, Ministry of Health, Government of India has taken utmost precautions, and they have put bans on so many things, and Government of Karnataka was proactive in this. Even though in India currently we have maximum number of cases currently in Maharashtra and Kerala, Karnataka also has significant number of cases, but Karnataka proactively took initiative to actually prevent the spread, which is commendable, and it's the right thing to do.
Yeah, I think we should treat this as a moral responsibility to ensure that we adhere to these steps that have been taken, and as much as possible avoid gatherings that the doctor also have mentioned, and the government is taking steps. One of the important things, doctor, I think everybody from a viewership perspective, if somebody feels that they have certain symptoms of infection, what should be their next immediate steps that they should take?
See, this is one of the biggest problem in this coronavirus pandemic, because the signs and symptoms of this virus are so similar to any other common flu. Like all of us have cold, cough, fever at some point of time of the year, especially children and also adults, weather change, sore throat. Yeah. So now this is the symptom, initial symptom of coronavirus. So the moment you get cold and cough or a sore throat or fever, do not panic and get worried, oh, I might have got coronavirus. The important point here is coronavirus would come to you only if you have had a contact with a possible corona patient. Okay, now the question here is, how would you know whether you have had a contact with this? If you have traveled to one of these affected countries where the number of cases are more, like for example you have traveled recently from China, Iran, Italy, United States, or one of these countries, there is a WHO website which says these are the countries affected now. So for example, if you traveled to one of these countries in recent time, in the last 1 month or so, or if you had contact with one of these persons who had traveled at office, at your workplace or something like that, then you might be at risk. Now the point here is, until recently when the shutdown was not there, for example, you might have gone to a mall for shopping or somewhere else, you might have accidentally come into contact with one of these persons, which you don't know. He or she which you have just passed by in the mall actually might have got infected, and you might have got some. So you don't know. Right? Yeah. So the thing is, every cold and cough at this point of time, when you get it, you have to self-isolate yourself. Do not get panicked and worried about it. Don't rush to the healthcare center and say, oh boss, I may be having coronavirus, please screen me. The health authorities are not going to screen you. Unless you have got a travel history or suspected history of contact with one of the coronavirus, they are not going to screen you. So they will say homebound. You have to isolate yourself, you have to quarantine yourself. Okay, so if you have cold cough, please restrict your travel. Okay, stay at home in the corner of the house, in one room possibly, have separate towel, separate linen. Okay, do not mix with your own immediate family members. Do not come out of your house as much as possible. Wait for 3, 4, 5 days. Once your symptoms get better, then it's okay. If for example by 3rd, 4th day you start getting more severe symptoms, like for example breathlessness, pneumonia like features, chest pain, and you need to seek high grade fever suddenly, and then you have to seek healthcare advice, then you go to the respective doctor, then they might screen you for coronavirus, and then they will tell you the further precautions, how many days you have to stay in isolation. Usually it's 2 weeks, but as a precautionary measure sometimes they may tell you for 3 or 4 weeks also.
But is the screening too complicated, doctor?
No, screening is not too complicated. Currently in Bangalore it's being done in Manipal Hospital, Apollo Hospital and Rajiv Gandhi Institute of Chest Disease, and it's not a blood test actually. They are going to just take a swab swab from your throat and nose. So just take a swab, and the reports would be there in 24 to 48 hours. And until the reports come, you need to be in isolation. If you are very sick, God forbid, you will have to get admitted into these hospitals in the strict isolation precautions. But if you are relatively well, then they may just ask you to stay home and take all the precautions to limit the spread of the virus. And then once the report comes, they will take a call on that. Yeah.
Well, I think, Doctor, one of the biggest myths that we often keep hearing is through social media. Right, we keep receiving WhatsApp forwards. We don't know which is true, which is not. What do you have to say about number of these messaging that comes from social media? We do understand that the power of social media is huge. It's immense. We're using the power of social media to let our viewers know what's right. But what do you think it's important for our viewers to not be feared of?
Yeah, I think you rightly mentioned, Naushad, that social media and internet has several advantages. Let's not talk about it. We all know how important it is in the current world, but then there are also some disadvantages and some problems with this. Now, for example, currently the problem that we are facing, coronavirus pandemic. Now, if you see all the social media in all your, for example, on your phone, on all your WhatsApp groups, the only messages which are circulating currently is related to coronavirus. Now, all of us tend to open it and want to know what is new, who is affected, which country is affected, which sports personality is affected, which film star is affected, God forbid who has died, which country they limit travel, and so on and so forth. But the important point here is, many times the WhatsApp forwards may not be actually the truth. They might not be reliable. So not just with coronavirus, Naushad, I am sure you are aware that many times many other things, whatever hot topics are being happening, it just spreads like fire. I wanted to share this with you. Actually, yesterday I got in one of my WhatsApp groups a forward where they said, what is the fastest mode of spread of coronavirus? And they were talking about whether it's travel, it's cough, sneeze, not following contact precautions, droplet, etc., etc. And the most importantly, WhatsApp was way ahead of everything else on a lighter note. But that's the truth actually. The way, so yes, media is important. Yes, it creates a lot of worry in the fear of people. And again, the main purpose of us bringing out this program on this particular topic now, see, news channels are covering this enough, they are giving enough information, newspapers are covering it, all the social media are covering. Why was it so important for us to talk on this topic again? The important point here is, yes, it's a global problem, yes, it's a very big problem. Prevention is better than cure aptly applies to this particular problem. More importantly, we need not panic about this problem. We need not to get too much worried about this problem. Let's understand the problem correctly, understand the facts, and take steps which would help in preventing, limiting the spread of this virus, and how we are going to globally contain and get better from this problem.
So, doctor, is there any particular treatment available for this particular virus, to treat this virus as on date?
That's why we were emphasizing so much on prevention is better than cure, and it cannot be aptly said more importantly to this virus. Why? Because see, most people who get this virus would get better on their own, like any other flu. But those are vulnerable groups which I mentioned, those are the ones who can get complications. So, for example, somebody gets pneumonia, respiratory failure requiring, God forbid, ICU admission, those are the people who would require treatment. Now, unfortunately, till date, we do not have a specific antibiotic or an antiviral agent available for this particular virus. A lot of research is going on, and hopefully soon we will be able to get some answers on that. At present, some of the medicines which are earlier used in, for example, malaria or similar kind of swine flu virus H1N1, and some of the HIV medicines and hepatitis virus medicines have been tried, and they have been found with some success, but as of now we do not have a specific antivirus for this particular problem. More importantly, it will be a supportive care kind of thing. That means you are requiring ventilator care, and then along with that whatever other supportive medicine. So we don't have a specific antivirus. That's where the worry is. So those people who get milder illness, they get better on their own, we need not worry about them. But those who get serious illness and they require, God forbid, ICU admission, how are we going to bring them out, because we do not have a specific antiviral there. And now currently a lot of research is going on to see if we can invent a vaccine for this problem, because now we have got this. Let's hope and pray that in next few months this virus goes away. But what if it comes back again in the next winter? Like, for example, the common influenza, you get it in the winters, and now there is a specific vaccine available for influenza which is getting updated from WHO based on the new strains which come. And this influenza vaccine is recommended for all healthcare workers and recommended for all the vulnerable groups, that means the elderly group and those whose immunity levels are little lesser, and those patients who are having comorbidities, which we did mention earlier in this video. So these are the vulnerable groups which need to take influenza vaccine. So a lot of research is going on. There was a recent report, I don't know how reliable it is, telling that probably we have got a first hand information on we probably will be the first people to get the vaccine, but it's still not yet out, and by the time it's implemented and we are able to use it, I think it's going to be some time until that time. That's why more importantly we have to concentrate so much on preventive aspects.
I think one of my key takeaways from this one could be that doctor, you're telling me that my body naturally may fight this particular virus, and I don't have to necessarily panic until I see those symptoms that we spoke of some time ago. Doctor, I think on that note, can you also tell us a little bit about what kind of food and nutrition focus areas should be for us, at least during these times? We often have been hearing about things, do not eat chicken or avoid non-veg at this point in time. Are those myths, or is that true? Can you just highlight those a little bit as well?
Yeah, so more importantly, the cold foods have to be avoided. So cold drinks, refrigerated items, as much as possible try to avoid the use of air conditions as much as possible, and use hot water. I mentioned warm water, salt gargles, and use boiled water for drinking. That would be better at this point of time. So chicken and mutton are not known to spread this virus, so we need not worry about it. As long as it's available, we can eat. Incidentally, Nausha, I am sure you read about it. There was also a small outbreak of cholera in some of the areas. Now cholera is a different disease. Cholera and corona are two different things. Corona is a new problem which we are dealing with now. It's a global health problem. Cholera is a disease which has been there for ages. Okay, it's a bacterial disease, and the usual symptoms are vomiting and diarrhea, abdominal pain, there may be some fever. Importantly, the moment you have vomiting and diarrhea 3-4 times, and then you become very weak, and you might require hospital admission. Some of them require ICU admission, their kidneys fail, shut down, they require dialysis, and there can be deaths due to cholera. So as a precautionary measure, doctors and healthcare workers are recommending at this point of time that avoid eating outside food. Homemade, well kept food is fine, because cholera spreads by food and water, contaminated food and water. So the mode of spread of cholera and corona are two different things. Let's not mix about it. So that's why probably it got mixed up and people start talking about chicken and mutton. But again, chicken and mutton, if they are homemade, well cooked, they are safe for eating. At this point of time, outside food preferably to be avoided.
Alright, doctor, so concluding this particular episode, what is that you want to leave our viewers with?
I think the message I want to give to our viewers is, firstly, coronavirus is a public health problem. Let's be aware about it. It can affect anybody. It's not going to be serious in everyone. There are only some target groups where it can become serious. More importantly, at this point of time, anybody gets cold, cough, please self-isolate yourself, limit your travel, limit the amount of spread to others, seek healthcare workers' advice, and do not be in ignorance telling that how could I get coronavirus? I have not traveled anywhere, I have not got in contact. It can be actually, we might have got into contact with somebody unknowingly. Most importantly, practice hygienic measures, strict hand washing, avoid handshakes, use of hand sanitizers, and limit the amount of mass gatherings and travel. That is the mantra for this current problem that we are facing with.
Alright, so I think the mantra is to maintain that hygiene and everything that the doctor just mentioned. Thank you so much, doctor, for spending some time with the Stylist Squad and also bringing that awareness that was much needed through this channel. So thank you so much for your time, and we wish everybody all the very best in dealing with this issue further. Alright, so that's it, guys. I hope you found this episode really helpful, and you will now go ahead and take care of yourselves, stay hygienic, and use all the preventive measures that we had Dr. Intezar speak to us about. Take care, everybody. See you guys soon.